Today I will be demonstrating few of the stations about the procedure skills. In this, the surgical procedures which are asked to be demonstrated, it's written on the stem, it can be. So I will be demonstrating on a mannequin. Person can be having a road traffic accident or the injury. In this, the injury can be on the arm, it can be on the thigh somewhere, a laceration of the wound is there and it can be a little bit contaminated or something. So you are asked to do the suturing. So this is suturing of the wound. It can be one station. So another station can be just there can be just like a pad, and here you have to demonstrate the different suturing knots, then ligation of the bleeding point, suturing of the bleeding point, and different types of sutures, and this there can be this. Another station can be a person having small nevus, and you have to demonstrate excision of the nevus. Patient is having road traffic accident, a pneumothorax on the right side or left side, any side can be given, a mannequin is there, and you have to demonstrate the insertion of the chest drain. So for that you need to understand about the chest drain and how it is inserted. And then there can be a case of patient having retention of the urine, and you have to go for catheterization. So these are the different instruments and the trolleys, the Foley's catheterization. So this trolley I just made it so that we can be able to understand the different stations where the procedure skills need to be demonstrated. And apart from that, there can be a simple station like ordering the theatre list. There is a sequence of the patients for the theatre kept, and you have to just rearrange the order and understand the theory behind it. There can be another station with a stem saying that today the theatre list is like this, and you need to do the pilot briefing. Means you have to understand your role, the role of anesthetist, the role of nursing staff, and all the things. So I will be covering one after other the different stations. So try to just remember the points, the questions regarding that, each station, and the suturings and all that. So this station is about stem which I am reading is that the patient of a person of around 25 years old lady who had fallen from the bike, and she has got injured her knee. So that stem says that you have to go and suture the wound. So I read the stem, and once I enter into the station, knock the door, give my candidate number, and then I sanitize the hands and introduce myself. Hello, myself Dr. Hamidul Kareem, one of the surgical doctors here. May I know your name and age, please?
My name is Sumit, my age is 20.
Okay, Linda Smith, may I call you Linda? So I think you have got injured, you have got an accident and injured your knee joint. So may I first check your wristband? So she's having red wristband. Or are you having allergy to any of the drugs, medicine, or any rubber or any cleaning material?
No.
So okay, have you got injection of tetanus in the past? Okay. So Miss Linda, I will be just checking about your wound. So I will just see the wound. If it is dressed, I will remove the dressing and then check the wound. I'm just feeling your pulses in the leg. Palpate this pulses. Are you feeling? I'm just touching your. Are you feeling it?
No.
So touching the sensation. Then just press the finger and check the capillary field. Okay, Miss Linda, just check everything. So you have got a wound on the thigh, so that needs to be stitched. So this is a procedure. It involves giving you an injection, which is we call it as a numbing agent, and it will be a little. You will be feeling a little small prick. After that, that area will be numb, and you will be have to stitch 3 to 4 stitches, and then cover the dressing. Is it okay for you?
Yeah.
Okay. So have you signed the consent form? So I will just check the, is it your signature? Okay, thank you. Then I will be checking the WHO checklist. Is it available? So the side, right side, the wristband, the name, this patient, everything is confirmed. So I will be just preparing my trolley. So when I turn towards this, I find the clothes, then put the clothes. Again, after sterilizing my hands, I put the clothes. Then see for the instruments. There is needle driver, forceps, plain forceps, tooth forceps, suture cutting. There is suture. So first of all, I check the suture. So can you check this? Its expiry date is around 29. So I confirm it and check the proper suture. This is a cutting needle, has got a triangular shape and 20 or 30 cutting needle and monofilament. If the wound is not draped, so I will be just cleaning the wound with the antiseptic solution, and each swab I just clean from center to away. So put this into the waste. So after cleaning it, so the drape, if it is available, I will be putting a sterile drape and cover the wound in this manner. So Miss Linda, this is covered. So now the wound is clean, and then I will be giving one injection which is a numbing agent. So I check again the expiry. This is 1% xylocaine having expiry date 29. So it will confirm. Then take the, Miss Linda, do you know how much is your weight? Have you idea?
14 kg.
Okay. So she is having 40 kg. So this is 1% xylocaine. I will just keep an idea in my mind that maximum amount it can be about 12 to 15 ml. So once I get this, the needle which is there, that has to be disposed and put a 25 gauge needle. So once then I keep a 25 gauge needle, another needle. Then Miss Linda, you will be getting a small, very small prick. Just so once I try to put the local inside, then I just withdraw the syringe out, check whether the blood is coming out. If it's no, then I will inject on this side, then on this other side, on both the sides. So after injecting the local anesthesia, so Miss Linda, I will be just waiting for 2 to 3 minutes. So till that you feel the numb. So after 3 minutes, I will be just checking it. You just tell me, are you getting sensation?
No.
So okay, thank you. So then I just take my suture material. This is monofilament. I will be suturing this wound in this manner. So you will be getting at least 3 to 4 sutures, and after suturing this, then I will be applying a dressing on this, and then you can take a bath after 2 days. So this is one stage. So assistant will be asked, if assistant there, cut it. As the needle is very short, I am just trying to secure the needle. These are the stitches, simple stitches. If I got a long length, it will be easy. Otherwise, I will secure this needle into the pad. So once I complete the suturing in this manner, so I will be disposing this sharp needle into the sharp, and then I will apply a sterile dressing and cover all these, and then dispose the drapes. So once I dispose the clothes and the drapes, Miss Linda, I will be writing a letter to your GP for dressing if you need to do, and what else you have to look after is that if you get any oozing, some sort of soaking of your dressing, or you get a pain into that side, or if you get some sort of blood or something reddish, this fluid is coming out, or if suppose you are getting a swollen, your thigh is swollen, you need to immediately attend your nearby GP, or you can come to the hospital. And stitches can be removed after 8 to 10 days, depending upon how is the condition, and then you can be able to join your work. So this procedure is done under local anesthesia. That's why it's a local numbing agent. You can go home immediately within 15 to 20 minutes afterward, and if you accompany any of the person while going home, so it will be better. Or you have to, you should not drive the vehicle yourself, someone else has to do it. So the next term, it is about a person having a nevus on the thigh. It is about a small mole, and excise the mole under local anesthesia. So I enter into the station, knock the door, enter the station, give my candidate number. Then I'm already putting it, actually I have to sanitize the hand, put the gloves, then turn towards the patient. So introduce myself, my Dr. Hamdul Karim, surgical doctor here. May I know your name and age, please?
My name is Sumit, my age is 20.
So Smith, I will be just checking your wristband. Are you having any allergy
No.
to any of the drugs or any numbing agent or any cleaning solution? Okay. Have you got the immunization or like injection of the tetanus?
No.
Okay. So are you taking any blood thinning agents? So as you are having a small mole on your thigh, so this procedure, it involves removal of the thigh. For that we do first clean that with the solution, then cover that and give a numbing agent. While giving this numbing agent, you will be feeling a little scratching pain, but once the injection is given, it will be numb and you will not be getting any pain. So what I will do is that give the numbing agent and remove that part, tissue of that, and then I will be suturing depending upon 2 or 3 sutures, small suture, stitches, and then afterward we will send that to for the pathology testing. So is it okay for you?
Yeah.
Okay. So have you signed the consent form? So let me check this. Okay, Smith. So it's your signature. So I have got a WHO checklist. So this you are having the mole on the right thigh, the wristband, the name, age, it's matching. So I will be just preparing my instruments. So first of all, I have already put the clothes. The person is painted, draped, and first of all, I will check the anesthesia. Smith, what can be your age, probable age and the weight? Do you remember the weight? Okay, it's around 40. So this one person's Xylocaine, the expiry date is 29 December 29. Okay. So the suture, the material, the expiry date on the suture material, I can check it. It's again 28 December. So all the instruments are ready. So before that, I will be just marking that wound mole with a scale, just to understand how much I have to remove. So it should be 1 centimeter above and 1 centimeter below, and around 3 to 4 millimeter on the side. Once I mark this small elliptical. So I will be removing this part. So this is a needle. I will just withdraw the local from this. Then discard this needle into the waste and use a 25 gauge, very small needle. This is 25 gauge, small needle. Ms. Smith, you will be getting a small scratching pain. Just I will be injecting this numbing agent. So first prick you will be little feeling. I will just spray it and see whether blood is there. Then I will put the local in all this direction on this side. One more scratching pain. Okay, thank you. So this is the another in this manner. Now I will be waiting for at least 5 minutes to get this. Till that, this mode will be sent for histopathology. So are you feeling the sensation here?
Yeah.
Yes. Now are you feeling sensation now? So it means this part is it's numb now. So I will take a blade, 11 number or 21 number blade, and apply. If it is already the scalpel blade is there, so these are sometimes so these are the different types of blades. I will be just trying to apply it on the ready-made. Actually this is ready-made, so this is the blade. I am going to excise in this way. So this is the specimen that will be put into the for the histopathology. So then I will just check the expiry of the suture material, and then if suppose there are pads or cleaning drapes are there, I will be just putting it and pressing, see that there is no bleeding. So then I will be taking few of the stitches in this manner. Get through it. So you will be getting a waterproof dressing. You can take the bath after 2 days, and you have to. I will be giving a letter to your general practitioner. So there you can contact if you feel any pain, any swelling, or any redness at that site of the dressing, or any difficulty in moving the extremity. So these are the things which you have to keep in mind. And you have to come for stitch removal after 7 to 8 days, or it can be removed at your GP. So after I will dispose this in the waste and apply a sterile dressing and dispose the clothes into the. So once this procedure is completed, I will be writing a letter to your GP and also fill up your histopathology form, and we will send this and give you a number. After 10 to 12 days, the report comes to at least your address, or it comes to our hospital. You have to collect it, and at that time also you have to remove the stitches. Is there any difficulty? Do you want any questions?
No.
Okay, thank you. The next term will be about suturing skills. The stem says that you go and demonstrate your suturing. That can be a simple suture, vertical matter suture, one point. Another is there is a bleeding point. You have to suture the bleeder. The third, it can be take a subcuticular stitch, or there can be a demonstration of one hand tie, or there can be demonstration of suturing the material, the suturing that inside the depth. So these are the different stems which you need to demonstrate. For that you have to put the, if the gloves are already there outside, you can do it, but if the gloves you have to put inside, just make a habit of putting the gloves as fast as possible. So this involves putting the right and left hand gloves. So this is skill procedure station. So here you don't need to do anesthesia or anything, everything is already there. So what you will be doing, first of all I will be demonstrating a suturing, vertical matter suture. So there can be, this is the skin pad, suturing pad. So what I take, the instruments, this one is the plain forceps, this one is the tooth forceps, this is the needle driver, and the suture is, it can be, this is the violet color means Vicry. I already put on the needle driver. How to hold this suture on the needle driver, it should be in this manner. So needle driver, suture, tooth forceps, and the suture cutting scissor. So first of all, the vertical matter suture. So initially, if you go with this tooth forceps, it is better to catch the skin. Just put 4 to 5 millimeter on opposite side, then remove it out. So to catch this needle with the forceps, it will be easier with a plain forceps. If you have got two plain forceps, it will be easy to catch it with the plain forceps. Then you remove this side, then on the opposite side so till around 2 to 3 centimeter this end has to be there. Then rotate the needle in the opposite direction, and now vertical mattress, it has to be closer to the edge. So this manner so if you have got long length, you just keep this secure at the pad, and these are the two ends. Take 2 rounds. First make it in the opposite direction, then 1 round in the reverse direction, then cut with the scissors. So this is one vertical mattress. So in this manner there are different things. Now if suppose this is a bleeding point, I will just demonstrate suturing. If the bleeding point is given, this is the bleeder, and you have to stop the bleeding point, then what I have to do is take a simple suture in this manner. First then running suture, fix this needle, secure it on the pad, hold this, and suture is just like a X form, or this is also called as figure of 8. So in this manner the bleeder has to be stopped. So this is the another way of suturing. So the another station, it can be taking a subcuticular stitch. If suppose I have to start for taking subcuticular stitch in this, so what I will do, first I have to make a first stitch at the corner inside, so the next station is stem among the stem was the suturing skill about the subcuticular. This is the wound where I have to take subcuticular. So what I will do is, first of all, the starting end is this, and this is the finishing end. So it will be done in this manner. So first stitch will be taken in this manner. Just I have to take it at the end and bring it out. So this knot will be going inside. So this is the burying of the knot. So this end will be cut, and so this knot is going in. So the stitch has to be taken in this a subcuticular way. So this has to be continuously sutured. So take these stitches continuous in a S-shaped manner. So the skin is getting approximated. So the last stitch, the end of the stitch, there can be different forms. Just you remove it, and this is called as Aberdeen's knot. So what you do for this, make a loop, bring it out, then make another loop, bring it out. So this is Aberdeen's knot. Finally, you bring the complete suture material out, and if this knot is still coming out, we can bury this knot. So the last knot can be buried. in this manner. So the knot goes inside and you have to give some traction and cut the suture. The suture is going inside and the wound is approximated. So this is continuous suture. So one more station is there where you have to suture. You have to suture inside the depth, and you can be given a simple suture like a silk or for example, this is the suture, and I have to put a simple suture around the vessel. If I have to instrument driven, so it will be with the help of instrument, and this is hook inside, and you have to pass around the hook like this. The hook is attached with the magnet, so I have to take a suture and draw this hook like this. Without that hook comes out, without the hook is coming out, I have to suture and slide my finger inside. So this is the way to demonstrate the skill of suturing in the depth, especially if I give more traction, that hook will come out. So that is the way to demonstrate the hook suturing in the depth. So it can be one of the suturing with the hand instrument. Oscar? It can be demonstration of suturing around this hook. You can see there is a hook, and this hook is very easily retractable, and I have to put this suture by the hands, by the hand around the hook or by the instrument. So I just cover this in this manner, and then without giving traction on that, I have to make a knot over that. So this is the way to demonstrate suturing. So this is suturing around the hook. While suturing, if I give much traction, the hook will come out. So this is the way to demonstrate the suturing around the hook. And then there can be one more station, just to ligate one hand tie. So suppose this is I am suturing around the, so this is one hand tie with the left hand, or there can be a tie with the finger or with the right hand. This is left hand. So the next station I am demonstrating about insertion of the chest drain in this mannequin. So generally this station, there is a stem where you are given, you have to put chest drain, something like that. So once you enter inside, introduce yourself, knock the door, give your candidate number, then you are asked. So you may be shown an X-ray, and immediately you have to check that the stem was showing that the person has come with the road traffic accident, difficulty in breathing, and X-ray was showing something like his lung fields are not visible on the right side, and then deviation of the trachea on the left side, and you have to say that there is pneumothorax on the right side. So if you find pneumothorax, what you are going to do? I am going to immediately, patient is having tension pneumothorax, put a needle thoracostomy in the right safe triangle anti-intercostal, fifth intercostal space, that is needle. The definitive procedure, what will be there? It will be the putting a chest drain. So the patient is having chest drain. Now the examiner asks us to demonstrate and talk through. So what you will do for doing the chest drain, you introduce yourself, wash, put the gloves, and connect. While doing chest drain, this is an emergency procedure. Patient has to be pulse ox saturation, the critical deviation, everything is checked. Now expose the mannequin is there. Expose the chest so that you can be able to see, and the patient's head will be around 30 to 40 degree, 45 degree up. This arm, right arm, has to be behind the head so that you can be able to see the axilla clearly. So this is the view, and you have just, after doing this, you have to identify the safe triangle. In females, the lower border of the breast will be the lower, and anterior will be the pectoralis major. In males, this is the anterior border of triangle, this is the posterior border. Now, so I will be just checking the drain. This is the chest drain. See the expiry date, the number of the drain. It should be for pneumothorax, it should be around 28. So once you see the drain, you see the end. If suppose there is trocar inside, you have to remove the trocar. If the end behind is not locked, you can to put a artery forceps like this. So while putting it, then what instruments are required? You just need a needle driver, tooth forceps, suturing cutting scissor, a scalpel, then the local anesthetic numbing agent, the syringe, and suture material. If the mannequin is already painted and draped, so what you will do, just take a position so that it will be easier if you get a chair and you can sit at the level, so that it will be easy to put the drain. And suppose this is the, you have to count the ribs from the sternal angle. So this is the sternal angle. So you have to measure from here, second, third, fourth, fifth. So here if you see, from here I am starting and counting on the right side. So this is the axilla, and this is the point where I am going to put the drain. So you will just ask the patient that I will be putting a numbing agent, and if patient is already anesthetized, there is no need. I've put a local xylocaine, and in such a manner that it should be upper border of the fifth rib. So this is a, then what you do is that if you are putting 26, and you have to put a, take an incision in such a manner around 1.5 centimeter horizontal incision on the intercostal space. So once you take the incision, put a hemostatic forceps like this and do a blunt dissection separating the tissues. So once you enter into the layers, serratus anterior, external intercostal, interintercostal, transverse into thoracic fascia and the pleura. Once you enter to the pleura, you put a finger and make a swiping movement in 360 degrees so that the lungs will be displaced out. So once you go in this manner, for example, you put this like this, then you make a swiping movement with a finger, and then just you try to hold and put a drain in this such a manner that the drain has to be held in this manner with the artery forceps, and it has to be pierced inside, and see that the distal end of the drain, it has clamped with the forceps, so that sudden if the gush of air will not be leaking. So you have to direct this towards the upper side, on the opposite side of the shoulder. So this is the way you have to put the drain inside. Once you are pressing and putting drain, you remove the artery forceps, and you have to insert the drain in such a manner that all the holes of this above goes inside the chest. It should be around 10 to 12 centimeter in. So once you are assured that this has gone inside, Then you have to connect this drain to the underwater bag and connect it with the underwater bag. So this underwater bag is like this, so that the lower end is having the water filled, and you connect it and you release the clamp. Once you release this clamp, then you have to check and see the person is coughing or air bubbles are coming, and when the person is taking the breathing, you will see the column of water column moving in this. So once the column is moving or you see some bubbles and there is no blood or hemothorax inside, you are 100% sure that it is inside the cavity. So once it is inside the pleural cavity, you put all this, and then what you do is that the drain has to be now fixed. So how to fix the drain? I will now the drain is actually inside the chest. Now how to fix the drain? So there are different methods. One is you just take a horizontal mattress. So you take a suture below the drain, then this is the horizontal mattress. So cut the needle and then like it in this manner, so that you can keep it. This is one of the way. So the drain is so multiple sutures are taken in this manner, and the drain is fixed. And then what the method of applying the dressing, when this drain is to be first of all secured, now you have to apply a dressing. So the dressing is done in such a manner that drain should not come out. So you put a dressing, simply cut in this manner, and then you put a long dressing. You just remove the sticking and put it, and again the same, this is cut. In such a manner that so this is secured. So this drain will be completely secured in the chest. So when the patient is doing movements, this is not coming out. So once this is completed, you have to confirm this by doing the chest X-ray. So this station is about stem, where you have to do catheterization. You have to read that this person is having retention of urine, go and do the catheterization. I enter into the station, give my candidate number, and sanitize my hands, then turn towards the patient, ask the name and age, Mr. David. So I can ask few of the things that have you got the similar problem of urinary if suppose he says that yes, he has been previously catheterized, I've got any history of trauma or something. So once before going for catheterization, I will explain. And can I check your tummy? So I will see whether the bladder, urinary bladder is full or what. So Mr. David, I will putting one tube, that is a hollow tube, through your penis. So that will help to relieve the pressure or let the urine come out, which is trapped inside. So are you having allergy? Let me check your wristband. Allergy to any latex or something? Okay. If he says he's allergy to rubber or any, so then if no, it's okay. So first of all, I will be just putting, if there is already draped, then it's okay. If it is not draped, I will just first clean the, first to retract the prepuce. I will be just retracting the prepuce and then cleaning the around the prepuce with the swab. If multiple swabs are there, I will throw this in the waste and then use another swab. So this is multiple swab. If the single swab is there, then I will say that I will be using multiple swabs. So first of all around the prepuce, then move from front, behind, 4 swabs like this. So once the penis and the tip, prepuce, everything is clean, so what I will do, I will just change my clothes and put a sterile drape and cover all the part where I am going to do the catheterization. So I put a drape, then I just collect the items. So this is the Foley's catheter. So I will be just checking the expiry, date of expiry. It's around 29 December, and see the number of catheter. Looking at the meters, I should be able to judge it is 14 number catheter. So then I will be using xylocaine jelly and looking the expiry date. It's again December 28, and then I will be keeping the sterile water and kidney tray in between the legs, so that it will be. So Mr. David, I will be pushing the numbing agent inside your penis. So you will be little bit feeling uncomfortable, but it will give you a numb sensation, so that it will be easy. It's okay?
Yeah.
So I am putting it now. So then after putting it, I will be waiting for 3 to 4 minutes. So once it feels numb at this penile area, then I will open the catheter and hold behind the tip. Then with the other hand, I will just introduce. So when I will try to push it, so once little bit part is gone inside, if the person is getting resistance, so Mr. David, I will be just trying it. If he gets no pain, so complete catheter has to be introduced. So you will be getting, because of spasm, some resistance. So asking to take a deep breathing so that it will be easy. So once complete catheter is passed inside, I will see that the urine is coming out. Once the urine is coming out, I will be just inflating this bulb with the saline and around 10 cc. Once I inflate it, I will connect the catheter with the Eurobag. So the urine will be collecting, and try to pull the catheter in such a manner. Then again put the prepuce back, and then the Eurobag is connected, and then I will dispose the clothes into the waste and all the items. So once the catheterization is done, I will check the urine output and see if the person is having relief. Thank you.